Connect MKE is sponsored by U.S. Bank. It happens once every 11 minutes in the United States. Someone dies by suicide. This month, there is a nationwide focus on suicide prevention and how we can all work together to prevent suicide and save lives. Joining us for this important discussion is Dr. Jerry Halverson, the Senior Physician Executive and a board-certified psychiatrist at Rogers Behavioral Health. Thank you so much for being with us to talk about this, Dr. Halverson.
Thank you for having me here.
Why is it important for us to focus time this month and every year on preventing suicide? How does it help us get a better understanding of this incredibly important issue?
Well, I think what's important for people to understand is that suicide is an important and growing concern for all age groups, particularly our teenage age groups, and as we get older, the incidence of suicide is just not going down. And particularly here in our state of Wisconsin, we are amongst the highest as far as rates go across the United States. So the one way that we can, I think what's important to say about suicide is people have these thoughts, and if they don't talk about it and they happen in the dark, they're more likely to follow through on it. It's important for us to be able to talk about suicide, to be able to have these conversations so that people hopefully make different decisions.
We do want to talk a little bit about what we're seeing in some specific age groups and other groups, but let's start really kind of at the beginning. What is usually happening in someone's life that has them contemplating or attempting suicide?
So not everybody with suicide has a diagnosable mental illness, although I would say far and away most do. Most of the time it's a mood disorder. Oftentimes there are people that have depression that are really unable to see a future ahead of whatever issue is happening right now. I would say generally there is an acute stressor, something going on, a big change, whether it's a loss of a relationship, a loss of a job. Oftentimes it's a really big issue in this person's life. And I mean, that's the key thing to remember. It's oftentimes a big issue that we have to help people work through, because once they're on the other side, then that suicide risk goes down. But it's generally somebody that has a mood disorder, that has a psychiatric disorder, oftentimes, but certainly not always, have had previous suicide attempts. There are people that are able to, that have what we call a completed suicide on the first attempt. And again, particularly with the access to guns that we have here in our state, people have easier access to a suicide attempt that is more likely to be fatal. So oftentimes, as I said, these are people that have a history of depression, but not always, and they generally have a large stressor or a big loss, or they're coming off a series of losses.
Let's talk a little bit about suicide in some age groups where we're particularly seeing concern. Suicide is the third leading cause of death for young people 15 to 29. What is it about that particular age group where suicide is something that is just devastating that population of young people?
Well, as you remember, it's a difficult time. Being a teenager is challenging. Oftentimes, you're not seeing what's ahead of you 10 years in the future. You're really focused on what's happening in front of you. What's happening in front of you is more important than anything that's ever happened. And when you're placing that type of importance and that type of significance on what's happening day to day, it certainly puts you at more risk of having a foreshortened future, of having thinking that I don't have a life after this, or there are issues beyond this, which is really one of the places that you want to intervene, because as I'd mentioned before, this is really about getting people oftentimes past this acute, we call it acute or subacute, either this event or the series of events that are really problematic, and get people seeing seeing what to do moving forward. And, what we do find that's particularly problematic in teenagers and on the younger end of the spectrum is if you have, in a high school, you have a suicide, then you tend to have other people having these thoughts. Suicide isn't the first thought that comes to people's minds, but it's a common thought. And I think it's something that we have to be able to talk about, because as people think about suicide and they feel alone and they feel that there's nowhere to go, that makes them even more likely to have this sense of the foreshortened future, that things aren't going to go well. And as peers and adults and siblings and parents, we have this opportunity to talk to them and to get them hopefully to understand that there's a future, because we've all been through breakups, we've all been through losses, but I think sometimes as a teenager, it hurts even more. So, you don't have that context or that
right.
to
As a teenager, whether it's a teenager or it's a senior citizen, someone who's older, how do we begin to have those conversations with people about suicide? I think there's almost this misconception that if you mention it to someone, they hadn't thought of it before, but now they are. So how do we have those conversations?
I think that's an important piece. I agree with you. I think there is this misconception that, boy, if I bring it up, they're going to, and they do it, it's going to be my fault because they never would have thought about it before. Again, what we find in what I find in my practice certainly is that you have people that are having these thoughts, and these thoughts are very isolating. They really make you feel alone. They make you feel even more different. They make you feel even more like nobody would understand. And for us to have these conversations and to understand, it's not to say, hey, it's a great idea, you should, that's obviously not the conversation that we're talking about, but we're talking about understanding where people are at and understanding the level of pain that it would take for someone to make that really final decision. So it's actually important to have these discussions. And I think the younger generations are probably better able to have these discussions than people your and I age do. We have two peaks for suicide attempts that end up getting completed. They're on the younger end and they're on the older end. And we're still dealing with a lot of people in my age group and older that don't want to talk about these things, that feel like they can't have these conversations. I feel like the younger generation is a little bit better having these conversations, but obviously there's more that we can do, because this is still such a highly stigmatized conversation to have, but it's important for us to have. And obviously, we might be afraid of having it because we don't think that we'll do it right. But really, I think people can see when it's coming from the heart, when it's coming from a place of concern. And oftentimes when I ask people this question, it certainly is not the first time they've thought of it. They've had these thoughts. It's common to have these thoughts. It's not necessarily common to have these thoughts all the time, have a plan, have willingness, but these are thoughts that pass through people's brains. And oftentimes it helps people feel heard. It helps people feel understood. Conversations can be extremely powerful.
So we've had that conversation, and someone has told us that they have thought about suicide or they have a plan for suicide. What do we do next?
I think it continues to be important to try to support them as much as you can, try to get them the help that's needed. I think most of us aren't feeling that comfortable to have these conversations. Obviously, in that conversation, you're not being a treater, you're being a friend, you're being a parent, you're being a sibling, you're being a spouse, and you're speaking from your heart, trying to make sure they understand. But we also have to not necessarily take it personally, because I think that's, boy, if they want to kill themselves, what am I doing wrong? What can I do differently? And it's generally not about you. It's about how this person is feeling. So try to have this conversation, have high levels of empathy with them, try to understand what's going on with them, help them to be heard, encourage them to go to, whether it's a pastor or a family practice, their family practitioner, or some trusted professional that can have these conversations and help connect this person to the help that they need. As it's not necessarily on you then to make sure all of this gets done, but certainly you can help this person feel understood. You can encourage them to seek out treatment. And obviously, if they don't seek out treatment and you're very concerned about them, that's a very serious thing that you have to think about, and that you have to talk you have to think about whether you get them help that they don't necessarily think that they need. There are ways to do that, but that's usually a very small percentage of these conversations. Oftentimes, these conversations, people hear their family members, and maybe they think about things a little bit differently, and they're oftentimes willing to get help if their cherished loved ones or their close friends encourage them to.
Dr. Jerry Halverson from Rogers Behavioral Health, thank you so much for having this important conversation with us.
Thank you very much. Thank you for your time.
And if you or someone you know is considering suicide or having suicidal thoughts, get help for them 24/7 by calling or texting the National Crisis Line at 988. There is someone there to help right now. We'll be right back.